Okay, I think we'll get started. Well, thank you everyone for joining us today. I'm so pleased to welcome you today for a really exciting joint announcement between Peterborough Public Health and Haliburton Kawartha Pine Ridge District Health Unit. My name is Evan Brockist. I am the Communications and IT Manager with Peterborough Public Health. And as I said, I'm really looking forward to the joint press conference today. I'll also note that today is Pink Shirt Day, which acknowledges the work to raise awareness against bullying. And I'd also like to just start us off with a land acknowledgement to note that we are convening today's press conference on the Treaty 20 Michi-Saugig territory and in the traditional territory of the Michi-Saugig and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. We offer our gratitude to the First Nations for their care for and teachings about our earth and our relations. May we honor these teachings. So just to walk us through the logistics for today, we have a few speakers on the call that we'll highlight. We'll also have an opportunity for all of our media to ask questions during the Q&A portion. I'll note that there is a live stream of the press conference, which is available at www.youtube.com at ptbohealth/streams. And so just to introduce our speakers for the day in order, we have David Marshall, who is the chair of the Haliburton Kawartha Pine Ridge District Health Unit, as well as Joy LaChica, who is the Peterborough City Councillor and chair for the Peterborough Public Health Board of Health. Also on the call today, we have medical officers of health and CEOs for both health units, Dr. Thomas Pigott and Dr. Natalie Bocking, who will also be available to field questions. And so without further ado, I'll just turn it right over to David for some remarks. Thank you. And sorry, David, you're just on mute.
How's that? Okay, thank you. Good afternoon to everyone. Thanks for joining us this afternoon for this very exciting announcement. Our purpose in convening this press conference is to address the suspense that has been building around a potential merger between the Peterborough Public Health and the Haliburton Kawartha Pine Ridge District Health Unit over the last several months. In August 2023, the Ministry of Health announced plans to strengthen the public health sector by offering one-time funding, resources, and supports to local public health agencies that voluntarily merge. The province outlined a deadline of January the 1st, 2025 as the deadline for these mergers to take place, with the funding for implementation over the subsequent 3 years. In November of last year, our organizations established a joint working group to review the feasibility of a voluntary merger. Findings from this working group were presented to both boards of health for consideration and to help them make an informed decision. Through this process, it was quickly identified that both HKPR District Health Unit and PPH have an extensive history of collaboration and share similar geographic, demographic, health status, and population characteristics. Both organizations are also dedicated to reducing health inequities and addressing the most pressing public health challenges faced by the communities which they serve. To that end, we are truly thrilled today to announce that the Boards of Health for Haliburton Kawartha Pine Ridge District Health Unit and Peterborough Public Health will seek provincial approval to voluntarily merge. I would like to acknowledge and thank the members of the Joint Board Merger Exploration Working Group, the members of both Boards of Health, as well as the consulting firm Sense Anew, for their work on the feasibility study that underpinned this decision. I'd also like to recognize the hardworking, dedicated staff of both organizations whose feedback has been instrumental in shaping this important outcome. We are truly excited about the possibilities that lie ahead for both of our organizations. I want to thank you for your attention and for your interest. Joy?
Thank you, and good afternoon, everyone. And along with David, I am thrilled to have the opportunity to address our community today in my capacity as chair for Peterborough Public Health. Health promotion and disease prevention have been the hallmarks of what public health units have accomplished in Ontario for close to a century. Often our work is unseen. However, the recent past has illuminated the critical role of public health in protecting and promoting our collective health. The pandemic showed that a strong and cohesive public health sector anchored in local communities is vital to our safety and well-being. In the Peterborough region and across the province, hard-working public health staff rose to the challenge in a moment of great community need, ultimately saving hundreds of lives. As we recover from COVID-19, public health staff continue to show up every day to address a range of pressing challenges facing our community, from food insecurity and drug poisonings to environmental and climate-based hazards and managing infectious disease. Unfortunately, these efforts have occurred in a context of long-standing chronic underinvestment in public health, a situation that's contributed to record burnout among Canadian public health workers and compromised our ability to confront current and future public health emergencies. We're pleased that the province has come forward with a plan to fund structural changes and to encourage local public health units to champion and shape the path going forward. In the Peterborough Public Health region, as well as with HKPR, we know that both health units have faced similar challenges, assembling the capacity required to address the breadth and complexity of needs within the communities we serve. We share challenges of vast geography, low population density, a lack of public transportation, and the impact of a cyclical economy. This highlights a significant core benefit of this proposed merger. By combining our teams of more than 300 public health professionals, we will establish a critical mass through which we will better be able to address current issues and future surges in demand. Beyond strength in numbers, benefits of a merger that have been identified include improved program expertise through specialist positions, cross-coverage of staff and succession planning, improved depth and strength of central corporate service functions, better surge capacity, resiliency, and less burnout, as I said, for future public health emergencies. Drawing on the unique program strengths and innovations of each health unit, improving efficiency in partner organization relationships across the full health unit geography, and finally continuing to sustain the current or improve levels of service despite financial challenge in an underfunded public health context in Ontario. The goal of our collaboration is to better serve the public and to continue to be good stewards of the financial resources entrusted to us. On the financial side, our Board of Health has carefully assessed current provincial funding scenarios for public health and has ultimately concluded that a merger is the best pathway. We have to protect, preserve, and enhance the programs and services upon which our community relies. While this decision brings closure to a question that has been hanging over both of our organizations for some time, it must be emphasized that this is the start of a process that will unfold over many months. There is significant work ahead, and both boards have charged staff under our board's direction to produce a plan that operationalizes a merger. Our goal is to enhance what we do not minimize our impact in our communities. I want to emphasize that residents can expect no immediate changes to existing services. I also want our residents to understand that this decision is subject to provincial approval, which is anticipated towards the end of summer 2024. It's my genuine belief, and that of the board, that we are making a decision now that will contribute to a stronger, more resilient local public health system. Thank you for your time this morning and for taking your questions.
Hello, everyone, and thank you, Joy. My name is Ashley Bolak, and I am the Communications Manager for the HKPR District Health Unit. I will be managing the question and answer portion of this media scrum today. So today we have David Marshall, our chair of the HKPR District Health Unit's Board of Health. We have Joy Lachica, Peterborough City Councillor and chair for PPH's Board of Health, and our medical officers of health and CEOs for both Peterborough Public Health and Halliburton Kawartha Pine Ridge District Health Unit, Dr. Natalie Bocking and Dr. Thomas Piggott, available to answer any questions that you may have. So in terms of questions and how it will roll out today, I'd kindly ask you to please raise your hand. When I call upon you, please state your name, the media outlet that you are working for, and your question, and we will do our best to direct to the appropriate spokesperson. So with that, I will turn my camera off, and also if you could kindly turn your camera on if you wish, that would be very helpful. Okay, today we have our first question from Mike Baker. Mike, please go ahead. Mike, you might be on mute. There we go. You just want to unmute your mic. Mike. Mike, we still cannot hear you. Did you want to try unmuting from your end, or alternatively? There we go.
You can hear me now, eh?
Yes, we can. Thank you so much.
Sorry about that. Yeah, so Mike Baker with the Highlander newspaper up in Halliburton County. I noted, Joy, that you said it's looking like end of summer 2024 for approval, possibly from the provincial authorities. Just wondering how much time you guys will need on your end once to complete this merger. Once once an approval comes down the pipeline.
Joy, please go ahead.
Well, the provincial voluntary merger process has indicated that while the legal integration of both public health units would need to be completed by January 1st, 2025, the funding for merger extends over 3 years. So experience from the previous health unit merger experiences suggests that full integration may take even longer. We're working towards a business case for the beginning of April, for April 2nd. That's where we're at right now, and that's where we're focusing our energies. Okay, Thomas, I don't know if you have anything to add to that, or Natalie?
Thank you, Mike.
I do have other questions, but I can wait until some of the other people have asked. I can come back.
Perfect. Thank you so much. Our next question comes from Trisha. Trisha, over to you.
Hi, I'm Trisha Mason from Global News in Peterborough. I was just hoping to get a comment from both medical officers of health, just their thoughts on this merger and anything they wanted to share with their residents.
Yep.
Thomas,
sure.
Why don't you go ahead first, and then I'll follow.
Sounds good. No, thanks, Trisha. Thanks for being here. Thanks, everyone, for being here. And thanks, Joy and David, for the remarks. I think from my perspective, I'm very excited by the prospects here. This is a really unique and special opportunity to rethink and improve how public health services are delivered throughout both entire geographies of the health units. This is a significant opportunity for an injection of provincial funding to help to improve public health service delivery and to help us go through a process that has been discussed a number of times previously, and on this time on a voluntary basis, really allow us to be the masters of our destiny in figuring out how we can best meet the public health needs of residents of our region. So I know myself and our entire staff and team are quite excited. There's still a lot to figure out, and this is going to be a long journey together, but it's been a pleasure working with Dr. Bocking so far and the colleagues at HKPR that I've had the chance to meet. So look forward to much more of that coming into the future.
Thanks, Thomas. I'll try not to repeat exactly what you said. I share in your enthusiasm. I'm excited about the opportunity that a merger such as this affords. I think it's important to acknowledge that HKPR District Health Unit and Peterborough Public Health already collaborate on many different initiatives. We share similar communities that we serve. We have the same mandate. We have the same vision and focus on health equity, social determinants of health. And we both have a long track record and history of serving our communities really well. And so what this affords us right now is to bring the strengths forward of each of our organizations to look at how we can maintain our services and strengthen them in the environment that we find ourselves in now. So I think a lot of opportunities and looking forward to beginning the next phase.
Thank you both.
Thank you. And thank you, Tricia. Next up, we have Dan. Dan, lovely to see you again. Welcome back.
Thank you, Ashley. Yeah, I think my question is best directed to the two board chairs, I guess. So during this process, were there discussions with other health units, or was this merger between these two sort of obvious from the get-go, I guess?
Well, I'll start. Thank you very much for the question. So PPH and HKPR have had a long history of collaboration, as Dr. Bocking has alluded to. This, along with a long range and a wide range of commonalities, makes the partnership a logical fit. And for this reason, other merger partners were explored, but not considered. We are also aware that other neighboring health units either do not meet the provincial criteria for mergers or are already in active talks with other local public health agencies regarding their own situation. So this really has become the best fit, and we're excited about building these relationships, the partnership that we have with HKPR. David?
Yes, thank you, Joy. Not to restate what Joy has said, but basically there is a natural fit between our two boards between the two health units. There has been ongoing collaboration. There's a lot of sharing of activities between the two units. Thomas and Natalie both work well together and have, in fact, communicate with each other quite often. So yes, we did look at other potential partners, but really in the end, the natural fit of our two units became the real focus of our efforts. And it's in that regard that we feel that this is just such a natural collaboration that the potential benefits which should arise make us feel extremely positive moving forward. So it just is a sort of a natural combination of effort and activities.
Okay, thank you, Dave.
Thank you, Joy. Thank you, David. And thank you, Dan. I will turn the mic over to David with your question.
Hello, this question is for both Dr. Bocking and Dr. Piggott. So the Ministry of Health is giving your organizations a one-time funding, should you two merge. Is there an expected amount of funding with this merger that you can disclose? And what kind of funding would you have likely received, had this merger not happened?
So I can take a first attempt at this, and then Dr. Piggott can fill in anything that I miss. So I'll answer the latter part first. All health units have been informed that we should expect, or we will receive, a 1% increase to our base budgets from the province for the next 3 years. So in the absence of mergers, and for those health units that will not be merging, of which there are many, the fiscal forecast is a 1% increase from the province for the cost-shared base budget. With regards to how much a merger would cost, the province has informed us they have a 3-year merger support fund. The amount of that fund has not been disclosed, and so we don't know what the province has put aside to be available for those health units that are merging. We had a feasibility assessment report that was done by a consulting firm that we mentioned previously. As part of that assessment report, the consultants did do some preliminary costing associated with some of the transition costs that we might expect. But the fulsome cost expectation really will be teased out over the next several weeks as we delve into a full business case proposal for the province. So we don't have a final number right now. I think part of that, when we're projecting a 3-year budget, we also know that we will have to make some assumptions based on what costs will be really for the next 3 years. So I'll pause there and I'll see if Thomas has anything to add to that.
Thanks, Natalie. Comprehensive answer. The small pieces I'll add is certainly that could be a question directed towards the provincial government regarding the size of the funding available, and they'd probably be the best to follow up with regarding that. I will say that some of our preliminary work has identified that there are lots of public health needs, and certainly, as you can imagine, with the funding context public health units have been in, as well as the impacts of the pandemic, which in many ways we still work towards catching up on programs and services that were paused. We continue to get assurances from the provincial government that eligibility for this funding, the types of things that we could request funding for, is a broad set of activities. And so we will be looking to comprehensively submit a compelling business case and budget to the province for this in order to accomplish the intended goals that the provincial government have for this, which is to strengthen the public health system. And we know that, 1 + 1 in this context, in this case, will be greater than 2. And I think it's really encouraging to see that the province has taken feedback from boards of health after previous exercises to look at and restructure the public health system and created this voluntary and really well-funded process so that we can ensure that we are successful bringing 2 organizations together and, most importantly, delivering the public health services that we're mandated to do to the residents of our community and our regions. So thanks for the question.
I just wanted to quickly follow up, if that's all right. Again, this is for both of you, Dr. Blocking and Dr. Pickett. Oh, thank you. I know that the Councilor Chika did mention this earlier of the benefits of the merger outside of the funding, but I would love to hear it from you guys, Dr. Blocking, Dr. Pickett, of what the benefits would be for this merger to happen, even if we just not talk about the funding aspect of this.
Did you want me to start first, Natalie, and then I'll pass it over to you? I think that the primary benefit is going to be strength in numbers and strength in capacity and size across a larger geography. And it is definitely a bigger geography, but not an enormous geography. It puts the geography and the population on par with many other health units in the province and means that our critical capacity could potentially be improved. There are a number of roles and positions in this organization that we either cannot provide, different nature of specialist positions and services to the community because we're too small, or we may have a solo person in that role. A very concrete, real example is both Dr. Blocking and I are the only physicians in our health units, in our respective health units. And so collaboration and coverage and support for a role like that is quite difficult when you're in a solo position. And so I think from both of our perspectives, and certainly what we heard from the boards of health, there's a lot of opportunity to improve the strength of our programs and services, have specialist positions, have greater capacity and resiliency to respond to emergencies, and really just overall collaborate more effectively to deliver public health services as best we can to the full region.
Thanks, Thomas. I think that was a fulsome answer, and I share in those those thoughts. I think I will add a couple of additional things. I think there will be some time found when we look at streamlining of services and some efficiencies found, and we will be able to put that time and any efficiencies found into additional programs and services. I think one of the benefits of the approach that the province is taking this time is that this is not, as we've heard them say, a cost savings exercise, and any savings that we do find can be reinvested in programs and services here. So, for example, we have many organizations that we partner with where currently both health units send someone to a meeting because we both are meeting with that partner on a regular basis. And so there's multiple examples of some potential time savings there that we can still use to put in and further expand and support our programs. And I'll leave it there for now. Thank you.
And I'll just ask one real quick numbers question. I'll get out of your hair here. Should this merger happen, how many people will both these public healths be able to service?
So if I understand the question properly, what will the total population be of the new entity that is serving the area? And it's approximately 345,000 people or so would be if we combine the two populations currently of Peterborough Public Health and Haliburton Kawartha Pine Ridge District Health Unit.
Okay, thank you very much.
Thanks, David. Great questions. Over to you, Bill.
Hi, Bill Hodgins, Peterborough Examiner. Thanks for doing this. Two questions. The first, I believe Joy mentioned something about a combined team of around 300 people. Do you have a rough estimate on how many people work at each health unit? And then maybe 3 years from now, do you think that number is still going to be the same? Will it go down from this merger?
I could possibly refer this question over to Dr. Bocking for your comment.
Certainly. So, I mean, I can speak to our current complement at HKPR District Health Unit, which including both permanent and part-time, temporary and casual positions, we're at approximately 170 people currently employed at the health unit. I can't, and Thomas will be able to provide numbers related to Peterborough Public Health. Our goal is certainly to maintain our combined public health workforce. The intent is not to reduce the workforce size in public health. We understand it's a challenging fiscal environment right now at baseline, and that a 1% increase from the province to our base budgets does not keep pace with inflationary pressures and commitments we have with for example, with our bargaining units. So we will need to plan based on the current fiscal environment, but the intent of this and the opportunity that it provides is to be able to maintain and ideally strengthen our workforce.
Yep, and I'll just add from a PPH standpoint, that number is about 130 staff. And I would echo Natalie's comments around maintaining, and I would say one of the hopes certainly would be even growing and building a stronger, more resilient public health workforce. That's been one of the lessons learned through the COVID-19 pandemic. The provincial government and the chief medical officer of health have certainly highlighted the need for public health to be ready for future emergencies and for the breadth of important work that we do. As part of the voluntary merger funding, the broader strengthening of public health includes other components, including re-examining what we're mandated to do through what's called the Ontario Public Health Standards. And the third component of their strategy is to look at funding equity or fairness amongst health units. A reevaluation of budget and adequacy of budget and fairness between health units has not been examined in many decades, and they've indicated as they go through this process that will be a part of the process, and certainly we hope that will mean a strengthening of our budget so that we can strengthen the staff and capacity we have to deliver our services to the community.
Excellent answers. And just as a follow-up, I'm not as familiar with how many physical locations there are in the HKPR region. Combined, how many physical offices are there? And do you think that will be the same when all this is said and done?
So I can answer on behalf of HKPR. So we currently have three footprint locations. We have an office in Port Hope, we have an office in Lindsay, and we have an office in Haliburton. So combined across the two current entities, there's four office locations. I know that both health units offer mobile clinics and outreach services in other areas. Discussions about office locations has not happened at this point in time. We're entering into the planning phase, but certainly right now there's no intent to change the physical footprint of what we have currently across the wide geography.
I'd echo and affirm that. Yeah, no, thanks, Stanley.
Yeah, sorry to cut you off. That's great. Thank you very much.
Okay, thank you. And looping back to Mike. Mike, thanks for your patience. Over to you.
Yeah, thank you. All right. Thank you very much, guys. You guys can hear me okay? Perfect. Okay, so just a few quick fire questions, but has a new name been selected yet for this new merged health unit?
I will defer to Dr. Bocking.
No, so a new name has not been selected. That will be part of the planning process and done collaboratively across both health units.
Great. And then I was wondering, this is likely to be a similar answer, but over who would lead up, who would be heading up this this new merged health unit, and Dr. Piggott, Dr. Bocking, if you guys are both going to be staying after this move.
I'll take the answer to that one, Joy, and then pass it over to you. How's that?
Sounds good.
The structure, the leadership of the new merged Board of Health, assuming that happens, is going to be a major consideration over the next few months. It offers us an opportunity to look at the structure, and some health units have MOHs and CEOs, and some have AMOHs, that is Assistant Medical Officer of Health. And as the unit grows here, there is more need for professional. As Thomas mentioned, there's only the two doctors, physicians, currently on the two organizations. So it offers an opportunity to look at what is the best structure, leadership structure moving forward. Given that the organization will basically double in size. So that's going to be a major consideration in the next few months. Joy?
So thank you very much, David, and you've answered so well there. The timeline for that communication will occur over the coming months between the boards as we proceed forward with the planning. But as we've seen here today and as we've listened, we know that Natalie and Thomas's collaboration and their relationship through the feasibility exploration period, it's been so critical to this successful decision, and the scaffolded process that we've taken with both boards of health at each respective table, the one-to-one conversations, small groups. We've really taken the opportunity to come to the decision, and we will move forward, and there will be more information to come on that point.
Okay, thank you very much, guys. And if you could, just one follow-up just on the financial stuff from a previous question from another speaker. I understand we don't know yet what the final number is going to be. We don't know yet what the contributions are going to be from the province. But has there been some preparing on both of your guys' ends as health units, in case there is some money that's, you guys have to put towards, have to contribute to? You might have lost the end of the. Did you get the end of the questionnaire? I'm having issues. It keeps kicking me out and bringing me back in, so I don't know how much you're hearing or not hearing.
That's okay, Mike. I do believe we did hear the question, and David, would you be able to address?
Yeah, I think that. Sorry, this was regarding the funding. Mike, I didn't hear the last part.
Just regarding the money it's going to cost to merge. I understand. I know there was a $3.5 million figure put out in a previous report, but we don't know what that number is going to be yet. We don't know what the contribution is going to be from the province. So I was just more so seeing if there was any preparation on your guys' end, if you guys are setting money aside in case you have to put a considerable sum towards this merger down the road.
Well, the very nice thing about the merger is that the government, the provincial government, has told us that those organizations that merge, the merging costs will be covered by the provincial government.
Okay.
And that there will be, in fact, additional money, not only for mergers, but also for business continuity costs. So we believe, Mike, I believe that there will not be a need for the two health units to put in additional money. In fact, it's an important aspect of the entire process that we believe that we will be able to not only pay for the merger with money from the provincial government, which will help us and they satisfy the requirements, the mandated requirements that we both organizations have in terms of public health, but it will also allow us to look at some additional things as a larger organization, which we may be able to do as part of that business continuity over the 3-year funding period, which we can't do at the moment as small individual units. And so that's part of the excitement and positive enthusiasm we have around this, that there is a real opportunity to actually move forward and do bigger and better things.
Great. Thank you very much for that, David.
Thank you, David. Just want to open the floor. Thomas or Natalie, did you have anything to add to that, or are we okay to move to the next question? Perfect. Wonderful. Thank you, Mike, for your questions. And yep. I see that we have Dan. Dan, did you have another additional question?
Yes, I did. Thanks, Ashley. I'm Dan here from the Standard again. So speaking to organizational structure for a moment, the boards of health themselves. I guess do you see the structure of those changing in the near or future term? And will you need to sort of go back to the municipalities as you merge as well?
Turn that question over to David. Would you like to provide comment as well?
Sure, I can certainly try. It's another part of the what you're really talking about is the governance and leadership or governance side of the merger or proposed merger, and that is something which is again another key aspect of the process that we will be taking, both as part of the business case, the preparation of the business case, which has to be submitted by April 2nd, but also in the months ahead to ensure, the size of the board, the municipal involvement in the board, the provincial appointee numbers on the board, the inclusion of First Nations, of course, which are a considerable part of both health units. So that's something which we have not spent time on to this point, but which is a principal key aspect of the work that we need to do moving forward, and it will be attacked fairly quickly. Dan.
If I could just add to that as well, to David's point, certainly we're needing to make a decision, and we have, and our business case for April. But certainly we have always, as two health units, believed that community engagement and delivery of public health services is really important. So we're committed to engaging with our partners and communities and planning for this new larger entity as well. So that's all part of the picture going forward. Thank you.
Okay, thanks, guys.
And I'm now seeing Mike. Mike, you have your hand up for a question.
Last time, I promise. Just realizing that question about the leadership, I understand the roles will be determined at a later date, but just wondered if, yourself, Dr. Bocking and Dr. Piggott, if you foresee a world where the both of you will continue in this, conjoined unit, and just if you have any comments on that about, the importance of perhaps working together through this transition.
I can start off and just say that I think, my impression is Thomas and I are both pretty passionate about public health. We care a lot about the work. We believe in it. And we're also committed to our communities. We both live in the jurisdictions we work in. We have connections. And so I think we're both committed to seeing the success of a new entity. We both know that we don't know what that will look like exactly, but we believe in its purpose and its objectives and want to see the best outcomes for our community. So hopefully I haven't spoken out of turn for Thomas, but that's my initial impression.
Thank you, Dr. Bocking.
And I just echo that it's been a wonderful privilege being able to work with Dr. Bocking, and I think certainly the boards of health, and the new board of health will need to make some decisions going forward. But very eager to learn more about that, and very passionate about public health and serving the region that we do. So thank you.
Okay, thank you both. Appreciate that.
Thanks, Mike. Great questions. Always appreciate it. I'm just going to open it up to the floor to give a chance for anyone who may be considering asking a question today. Please put your hand up and we are happy to provide a response. Just give it a couple of seconds. All right. Thank you, everyone, for attending our virtual media scrum today. As echoed by our board chairs, Joy Lachika and David Marshall, and our medical officers of health, Dr. Natalie Bocking and Dr. Thomas Piggott, we are focused on growing a stronger and more resilient public health force, and we are going forward together with optimism. I want to extend a big thanks to all of our local media and attendants today, and for the thoughtful questions that you have asked. You are a valuable way in which we can communicate important public health messaging, and we truly appreciate your continued patronage for both of our health units. On a technical note, this is live streamed, so you can pick up the stream on Peterborough Public Health's YouTube channel, or alternatively HKPR's YouTube channel. And with that, have a wonderful rest of your day. Take care, everybody.
Thank you. Bye.